am so excited about not only being here in Montgomery County as a part of a series of fora that we are hosting. I want to thank Uma and your staff for hosting us here this evening. I want to thank you for the involvement of Montgomery County in the legislative process to develop these health enterprise zones. I want to thank Roger Mano and his colleagues in the Senate, Marisol Gutierrez, her colleague in the House of Delegates, for working with me and the governor to develop this proposal. And I certainly commend to George and Valerie that you put forward a very strong application, because I would love to see an HEZ right here in Montgomery County. And I think it's important to point out at the outset that part of what we're doing now is to develop the regulations and so your input is very important. So I know that Valerie talked about whether you census tract data versus zip codes, and we're working all that out. And that's why we're here tonight to solicit input from the community, because we want this to work. And this is a pilot program, right? The pilot program. It's a robust pilot program. The governor put $4 million in our budget this year to fund these health enterprise zones. We don't know yet how many there are going to be, but I can tell you we ought to be able to, in 3 years from now, when we look back on the success of it, we ought to be able to look at an urban core and say it works. We should be able to look at a rural community and show that it works. We should be able to look at a ethnically and culturally diverse community and show that this concept works. So I am certain that based on the criteria that we've had in statute, based on your involvement, your input here, we're going to craft a program that enables us to develop these health enterprise zones in the communities around the state, and in the communities that give us an opportunity to really test it. Because 3 years from now, we're going to go back to the legislature and we're going to show that when you can provide incentives in a community, we can really begin to address health disparities. And then we'll be able to make the case for greater investments in more communities around the state. About 18 months ago, the governor and I were talking about health disparities in Maryland. We had a conversation and said, we really got to do something. A lot of good things are going on in Maryland to address health disparities, but we really need to do something, really step up the investment, the commitment. We said, well, let's think about that for a moment. And we looked at the economic development arena. We said, well, we got these things called economic development zones, where you have high levels of unemployment. So we created these economic development zones where you provide property tax and income tax incentives for companies to locate and create jobs in these communities where you have high unemployment. And those programs have been quite successful in the state of Maryland and around the country. So what about creating incentives to do the same thing to address health disparities? So that's what this program does. It provides incentives, whether it's repayment of student loans for physicians that may be moving into the targeted community, whether it's income tax credit or relief. It may be a job hiring credit, because you may have a provider who's already in the zone who says, I need to hire a few additional providers to deliver this much needed service to address this particular chronic disease in this community. So we offer, as one of the options, the incentives, hiring credits. There are grants available for capital improvements or equipment that may be needed in order to deliver greater and more enhanced services. And the beauty of the program is, we don't tell the applicant what incentives they need to use. We've got a long list of incentives, and what applicants will do, nonprofits working with the local departments, they'll develop the strategy. You will develop the strategy for delivering enhanced services in this targeted community, identifying the strategies and the resources that are coming into the community that you'll bring into the community, and then you'll look at our list of incentives and say, in order for us to do this, we need to use this incentive, this incentive, this incentive. We'll agree on what we're going to do, what we're going to measure to determine whether the strategy is successful at the end of the day. And again, like I said, we'll come back in 3 years and we'll demonstrate to the world that this concept, which no other state in the nation has developed this concept. We'll prove to the legislature, we'll prove to the state, we'll prove to the world that with financial incentives, we in fact can reduce health disparities in Maryland and anywhere that they exist. So I'm really excited about this program. I feel honored to be able to call Martin O'Malley my partner in public service, because in this very difficult budget environment, right, where we're level funding most programs at best and reducing funding for most programs, the governor saw fit and the legislature agreed that this is an important program and we're going to fund a new initiative. There aren't a whole lot of new initiatives that are being funded in Maryland or any other state in the country. So I'm real proud of Martin O'Malley, his leadership, his commitment to this. Again, I'm very thankful for the General Assembly. Dr. Sharfstein, who's our health secretary, has promised me that this will be successful. But look, thanks for being here tonight, and let's make this thing work, okay? Thank you very much.